flu and other illnesses not only set us back physically, but mentally too. Joining us to discuss this is Dr. Kimberly Hartney, a psychiatrist with BayCare at St. Joseph's Hospital North. I have a lot of questions already. This is an interesting topic. First off, thanks for being with us today.
My pleasure. My pleasure. Thank you.
So I'm going to dive right in. I mean, these common colds, flu, viral, we just had it in our house. It has an effect on our mental state?
Yes, we actually know that everything that's sad is not depression. We know that illness can actually trigger an inflammatory response that causes a biologic phenomenon to change in our brain. That actually will start changing the way that our body produces serotonin and it gets stolen away, all in an acute process that happens very, very quickly. It ends up resulting in a constellation of symptoms where you start feeling lousy. So this is with a common head cold. We can see that you suddenly lose interest in calling your family members. You still love them very much, it just feels like more work. You may feel lousy, you feel your favorite TV shows are no longer as funny, your favorite foods don't taste as good, and when you sleep, you don't feel restored. In general, it's called a sick syndrome, and it's the result of mental health symptoms arising due to that infection.
You explained that beautifully, by the way. I actually understand it, and I can relate to this. I feel like I've been there before.
Everyone.
So what do we do, though, if we start to have that like rundown feeling, which I tend to get before, I actually have germs. What can we do to help our mental state?
So, it served a purpose. It biologically changed so that we used to protect our tribe and we wouldn't spread the disease around, and we would be more alert while we were sleeping so that we didn't get attacked, and we dumped our iron stores by eating less. But what we find then is those symptoms then are serving a role. So if we can reframe it and say, this is not me, this is actually depressive symptoms that are the result of the infection that I'm experiencing. We also know that we can do certain lifestyle modifications to help us feel better as well.
And I know there's a specific chronic condition, for instance. We take lupus in this example. What kind of psychological impact would that have on something like these chronic conditions when it comes to patients?
So it goes far beyond just lupus. Any sort of pro-inflammatory state. So people who get recurrent urinary tract infections, patients with cancer, patients with multiple sclerosis, lupus, all of these pro-inflammatory states that are now chronic that we see, where before they should last the period of the quick infection and then resolve. Now they persist. And sometimes in vulnerable adults will result in needing treatment.
Interesting. Okay, so let's talk advice, though. You are treating your chronic condition or treating, if it's just a cold or flu. What do you do for patients so that we can be mentally resilient when going through these things? Like, when do we give you a call?
So there's behavioral strategies that we can use to actually reduce inflammation.
Yeah.
So we know that cognitive behavioral therapy can actually reduce inflammatory markers and make you feel better. There's apps on the phone that are free to use. We also see that lifestyle changes. So going for a walk can be very helpful. Doing inside yoga, low intensity workouts, offering yourself probiotics and listening to music can all be ways that will help you reduce inflammation and then in turn, reduce those symptoms that are making you feel lousy.
I love too that you kind of gave the gamut right there. We can call you, but also find apps on our phone to help. So, if you want to learn more about the behavioral health services at BayCare, go to baycare.org/mental wellness. Again, Dr. Hartney, this has been a fabulous conversation. Thank you.
Well, thank you so much for having me.